at ASAP. And I'll be presenting today. So for those of you who are new to the ECHO setup, you'll see that this first part is a topic that relates to the treatment of substance use disorders, and of course, opiate use disorders, and maybe even like more of a therapeutic aspect, but we also talk about medications and medical treatments. And today is motivational interviewing. There is a CE link to this, and I know Julie just talked about it. Sorry, I only like blanked out. In terms of disclosure, there's no financial arrangement in regards to any content of this presentation or for giving the presentation. This is a presentation that was prepared previously by Dr. Lindsay and Dr. Bott. And again, is the stages of change in the spirit of MI, motivational interviewing. And in terms of objectives, it's a very brief presentation. It's meant to scratch the surface, hopefully get you interested in learning more or even getting trained in motivational interviewing, as it is a very essential tool in the treatment of substance use disorders. And hopefully at the end, you're able to at least understand how does the trans-theoretical model of change could work along with motivational interviewing. How can you apply some of the at least the overall spirit of motivational interviewing, and being able to be familiar with some of the guiding principles of motivational interviewing. So why do we always start with the stages of change, or why do we talk about the stages of change with motivational interviewing? One good clarification point: the stages of change were not developed with motivational interviewing, but very often they're used together. And one of the things that you'll notice is that the stages of change can let us know, first of all, where someone is at, and then what type of intervention we can use. And so what can be really helpful is being able to respect where that individual might be, and then maybe knowing what kind of tools would be the most helpful. You can definitely use different things when you find where people are in terms of change. But some of them could actually prove to do the counter very thing that you're trying to do, which is moving them towards a healthier change. So if you look at the stages of change, you'll notice that there's a spiral, and that implies that you can start in stage 1 and then move right into stage 3 or 4 of the stages of change. And then you can go right back to maybe 2 or even all the way to the beginning. So because it's a spiral, it can move, it's not linear, right? So it just moves back and forth, which what we're going to talk a little bit about in terms of relapse that we see in substance use often, and how it is viewed very differently when we're thinking of motivational interviewing. If you notice at the beginning, we have pre-contemplation. That's when somebody does not have an intent to change. Moving to contemplation, maybe wondering what might that be, gathering information, preparation, it's getting ready to change, and then moving into action. Once somebody has been doing the new behavior, it's sustaining it for a certain amount of time to be called maintenance. But then again, always considering that there could be a possibility of relapse, which is very common, but viewing relapse as an opportunity to be able to address something in treatment, right? And so here, this slide is, by the way, you will get copies of the slides. One of the things that's really interesting about this slide is what might be some things that that you're looking to, that a patient is exhibiting. I pause this for a second because you use this with everybody, supervisees, sometimes with family members, in terms of how to support them in change that is positive. So one important thing about the pre-contemplation is that that individual does not even see the need or the reason to change. So the more we push for them to change, the more they're going to fight us back. There's a great picture of 2 elephants in a minute. You'll see it. Again, it's just like really heavy pushing against each other. If we try to make change happen, especially if we try to make it in a very like, I'm telling you what to do. I notice that once somebody is in contemplation, they are considering, so they're ambivalent. So that is an excellent place to be able to use motivational interview. You'll see it in a minute, because somebody's at least willing to. One of the things that's really interesting about motivational interviewing that gets misunderstood is sometimes people think that motivational interviewing should be used at all times, which is incorrect. When somebody is in action and maintenance and even preparation, motivational interviewing is not needed, because that person has already moved into wanting to change and having a clear picture as to why they want to change. Perhaps the only difference is whether they got started or not, but they're already there. So using motivational interviewing is not necessary. That's when perhaps you get engaged in other things, like CBT, ACT, etc., depending on the type of substance and type of treatment that you're providing. So notice again, like I mentioned, you can use some motivational interviewing even when there isn't a full ambivalence, but it works best when there is that full ambivalence, like that person is saying yes and is saying no at the same time in terms of change, in terms of wondering what they can do. Sometimes it can be as simple as somebody coming in and as we're asking them, as we're using motivational interview skills, so what is one thing that's bringing you today? And sometimes they might say something like, my wife told me that if I don't get treatment, that she's going to leave me, or that she's going to kick me out of the house. And so sometimes we can even start with something like that, like, okay, so it sounds like you're pretty tired of people kind of nagging at you. And so that in itself is what we call that change talk. We start to talk about the reasons of somebody changing. We also talk about, we use rulers and other things where patients can tell us why they want to change, how confident they feel about changing, etc. We'll talk a little bit more about that. But my point is, it's just you can grab any tiny little grain of anything to be able to jump into that change talk. What's really interesting, very often we forget or we think that we don't hear it, but there's always that ambivalence. When somebody's in contemplation, the ambivalence is always there. It's just a matter of getting at it. And how do you get at it? And we're going to talk about that. So in contemplation, again, seeing that there's a inability to recognize that there's even a problem. So if you think of any of us here today, we might be overworking, right? 60, 80 hours a week. We don't see that that's a problem, right? Our family definitely sees it, not us. And so so that is probably not, it's a little bit tough to start telling someone what to do, right? So maybe family members tell us, you really need to be home more often, but we don't see it, right? We see maybe why we shouldn't be home, why our patients really need us. And so we're really focused on the reason why not to change. So again, that goal is really bringing the awareness, right? So all we can do in that stage is listen, elicit more information, right? We can ask, well, how has it been in the past, right? So sometimes you might have somebody who says, I don't know, I'm just here. I just have to be here. Okay. And you talk about the nagging, and they're like, nope, I could care less if they nag me. Okay. And so why would you want to change, right? What has it been like in the past with you, say, for example, drinking? Well, I don't know, there've been a couple of times that I got DWIs. Then they start telling us how much this has been a negative experience. And so there are times that they start hearing all the negative consequences that are happening due to the substance use behavior. And then communicate. This is the part for us to build rapport, not for us to be the ones that the ones that know what to do in the room. Because that will definitely make our patients run away from us, because they think that we want to tell them what to do, and we're not really understanding what they're going through and what is it that they're experiencing. Once they're in contemplations, once they have a little bit of ambivalence, we grab onto that. And so what we want to do is sustain, continue, or keep that person in that talk change. Sometimes what's really interesting, us as providers may be actually using not change, but just like a continuation of, right? So something like, it sounds like you you want to stop, you're so tired of your wife nagging you, but it's not enough. And so that almost like, it's convincing that individual to feel like, yeah, they should change, but then, but it's not enough nagging. I mean, it's kind of okay. So we just brought them back to, yeah, you don't need to change. So sometimes when the way we talk to our patients may actually bring them back to a state where they don't want to change. So that's something that's very interesting when you get trained in motivational interviewing. Really listening, how are you using that change talk, right? It's okay if you use like a, this is why not, and this is why yes, but always ending with this is why, yeah, it sounds like you want to change. Notice that you're addressing the discord, and there are different tactics that you can use. One of the important things is sometimes thanking them for being there. Well, thank you. I see that you're here. It sounds like you really don't want to be here, but you're giving me 5 minutes. So let's talk about what do we want to do in those 5 minutes. So we're not fighting. We're not going against them, right? Versus trying to convince them. And again, always being genuine, sounding genuine to them, and then supporting their self-efficacy. Because the moment that we start talking about, well, let me tell you, every time that you're using opiates, that's really affecting your body and your organs and this, and you're gonna lose housing. We just lost them, right? So fear tactics and others, not as useful as much as is their own idea. For those of you who are movie fans, if you have ever seen the movie Inception, and it talks about how like the idea has to come from within, right? And if you happen to see the movie, the moment that something is in your head that is not yours, it's almost like the rest of your head knows, right? It's like all the attention is there, ready to reject it. So imagine that that's how it is when you share with your patients what you think they should do. That idea is so foreign, it's not theirs, that the body's very, very automatically trying to reject it. Nothing like being able to talk to them as to what it is that they want to do and how, right? So once they're in action, our main goal is we're not using motivational interviewing. We're encouraging progress, reducing barriers, and then moving them along. So I had mentioned to you that I'll mention very briefly about relapse. Very often we used to see relapse as a negative thing, right? So relapse means that they're going back again. We're going to start from zero. That means for those patients who think it's about their choices, they just chose not to be healthy. None of those, right? A relapse will happen in substance use, so it's good for us to talk with patients about it. I think sometimes if we can be mindful, we can see that our blind spots kind of sip into it, repackage, and we spit it back to the patient, right? So I might feel very concerned, right? So a couple of weeks ago, had a patient with who hadn't been using for a year. All of a sudden she's using, not as often, but is using once a week. It's an opiate, which is pretty strong. And so my fear comes into it, right? And so what do I want to do? I really just want to tell her what not to do. I want to tell her how scary it is that she's affecting her recovery, that she's affecting her family, but that's not my place. So instead, if we can be okay with a little bit of discomfort, be able to see that opportunity as a chance for us to say, okay, we put in quite a bit of skills. So let's see which of the skills that you have might not be working, or maybe we can adjust to use when you're feeling a certain way so that it can change. And then let's look at new ones. Let's look at other things that you can do. It doesn't have to be just therapy with me. It could be going to a group, having your physician reassess your medication, etc. So then if we talk about it that way, I keep my fears in check. The patient feels that they're empowered to be able to make change happen. And as they're having those highs or acute episodes, they're starting to go lower and lower and lower, right? So we definitely want to make sure that we're not making the process worse. So the goal is help them avoid becoming discouraged, help them re-engage in the change process, because they can pick up our fear. right? And then there's two of us in the room who are really petrified, and now we're frozen. We're unable to move. Why do we need to know about the spirit? So with motivational interviewing, you often hear about the spirit. That actually, it permeates all of what happens in motivational interviewing. Think of this thought. People are generally better persuaded by the reasons which they have themselves discovered than by those which have come in to the mind of others, right? So like I was telling you, like in the movie Inception, if it is their idea, they know their barriers. We don't. They know how to get out of those barriers, how to reduce those barriers. We don't, right? So we make a lot of assumptions. And again, we are providing advice and guidance within what we know, within our lives. Might be a little bit of even some biases that we don't even know, right? Some blind spots. So motivational interviewing, it's a very effective method about talking about change without telling people how to change. It's collaborative, very person-centered, and there's lots of benefits to changing behaviors, lifestyles, etc., which it's in line with chronic illnesses, which is in line with substance use, right? And so let me see. So I just want to show you a little bit about the research. There's quite a bit, there's extensive research. I mean, there have been several decades of this was developed, and especially in the area of substance use. And you'll see, for example, in the HEDMA study, you see it even talks about an effect size. An effect size is how strong what we're seeing is statistically significant. So when you talk, usually in most studies, you see a small effect. So when you talk about a medium and higher or larger effect, you're talking a very, very strong effect in terms of changing. And you'll notice that there's some moderated effect when it comes to credentials and substance use, but you can also see what have been some areas where it has been, but it has a very large effect, right? So weight loss, blood pressure, and substance use, which is relevant to us. And here's a nice kicker: as low or as few as one session. So what approach can we talk about that can be as successful as low as one session? So that's a really good record, right? So and we talk about that ambivalence, right? So in the spirit of motivational interviewing, we are okay with ambivalence, right? We're not going to fight it, which is our first instinct, especially as providers, right? So feeling okay about something being two ways, a yes and a no, right? Lack of motivation is often ambivalence. Instead of thinking, gosh, here comes the difficult patient, here comes the patient that I just don't know what to do. They probably are ideal for motivational interviewing. It's finding that place where we are not arguing or fighting with them as to why they should change. If you think normal part of the change process is ambivalence, right? All of us, including those who are sitting in this room, have gone for everything that we do into an ambivalent state before we actually made a decision. It might have been very short, it might have been very brief, but we go through it. And not getting caught in that communication trap of arguing one side and the other person feeling that they're defending themselves, right? So in motivational interviewing, they name let me tell you what you should do. They name that the writing reflex, right? And the danger in the writing reflex is that we're telling people what to do, how to do it, why they should do it, as if by doing that, individuals will all of a sudden feel that that's the reason why they want to change. And what happens is that actually creates resistance instead of change. Why does that happen? Why do we get caught? Sometimes we don't see it. Sometimes we don't notice. It's kind of hard to catch ourselves that we're actually in the middle of telling somebody how to change it, why, and what should be their reasons, almost like what their values should be. Sometimes we don't know. Sometimes we don't know how to not do it. And there are times that people, I'm pressed by time. I got to tell you what to do. That's all I have for today. I need to move on. And so that can affect then how do we express and how do we instill change or not instill it really. So when we catch ourselves, when we try not to tell people what to do and why, then they're able to come up with their own insight. Even we can talk about skills and we can talk about how that can be. So here's a picture that I was telling you about the elephants, right? So every time that we tell someone, oh, so I see that you're a smoker, you know, you should not be smoking. We just engage in this fight, right? And so from this moment forward, we're going to be going back and forth. Okay, so when that happens, then there's our patient shuts down, it's not listening, there's no motivation. And what do we think? Our patients, it's their fault, right? They're not motivated. So in motivational interviewing, we talk about the rule, right? First of all, try not to do the writing reflect, understand their motivations and listen, right? So that we can empower them to be able to make a change. When we talk about the components, you see the spirit, which encompasses everything. There's principles that affect how do we go about it when we use the skills and the techniques for it. One of the things that we talk about in motivational interviewing is, again, the acceptance, collaboration, evocation, in order for us to be able to move that change, right? So accepting that they know best, not us, and that we're collaborating as they're trying to change. So there might be times where a patient is asking, what else do you think I should do? And we might ask, well, have you tried this before? What are some things that have worked for you? And what have been some things that haven't worked for you? So in the evocation is, again, why might you want to change? I was telling you about the ruler, right? Sometimes we use a 1 to 10 ruler and we might ask an individual, well, so as you're talking about reducing your use, what do you think? How likely is it that you're going to do that from 1 to 10? And they might tell us a 3. I'm like, okay, so what made it a 3 and not a 2? And so then they're telling us what their values are. And then there are times that we say something like, so what would make that 3 a 4? And then now we're talking about how to address the barriers. You have a couple of details in the next slides about this. And then here's a last picture, right? So hopefully our interactions with our patients don't look something like this, where we're just fighting and telling them what they should do, and they keep telling us what they're not going to do it, right? So what about going for a walk? Well, I don't have time after work. What about making time after work? Well, it's very difficult. How old is instead of having that fighting, doing something where we're moving along with them, right? So it sounds like walking is not a good option for increasing better behaviors. So what might be one that you can come up with? Okay, how might you do that? How confident do you feel? What do you think will get on the way? How might you address what gets on the way? So essential motivational interviewing to be able to use it with our patients. I'm gonna stop the share. That's the last slide has the references. I'm gonna stop the share, but again, think of an essential tool that you want in your toolbox for talking with patients, because you will more than whatnot catch yourself doing the writing reflect, right? And this is, you're getting ready, you're not pending. Here's what you need to do instead of. Sometimes you can do referrals. You might be the person that says, okay, so here is the diagnosis, here's what's going on. I'm going to send you to our case manager. I'm going to send you to our therapist. And then the therapist is the one that engages in motivational interviewing to be able to set up goals. So depending on what tools you got or what teammates and interdisciplinary individuals you have in your team. So I don't know if you have any questions. Again, you'll get the slides.